This is SiriusXM Doctor Radio.
And now, from the heart of the NYU Langone Medical Center, this is Doctor Radio Coronavirus. What you need to know now. Here is your host, Dr. Marc Siegel.
I like to say that the United States has a soft underbelly. Working with our vets who definitely don't have a soft underbelly, does that make you feel that this whole coronavirus hysteria is just part of not being used to being challenged by real threats?
It's a great question. I think what we're really struggling with is the unknown. And oftentimes, we as people, when we're dealing with the unknown, we make negative predictions that are not necessarily based in our reality.
But if you're on patrol in Kabul, but you're not going to find one of our great soldiers serving overseas, in the war theater or this prolonged war theater, thinking about a virus, are you?
I think our soldiers that are deployed are conditioned to deal with combat-related stress. They go through a lot of training. And then the more time they spend there, it becomes the reality. Right now, as a country in the United States, we're adjusting to coronavirus. We very much have what I think is a cultural adjustment disorder. And it may be this way for some time. But my guess is that within 6 months, people will have adjusted and there will be decreased anxiety.
So how do we prepare and battle through our fear at the same time?
So something that I think is really important is maintaining structure in your daily life. A lot of people are maybe no longer exercising. They're not doing the things they normally do. They're not going out to dinner. They're not going to the movies. So they're giving up their structure. When we lose structure, we kind of open up our mind, our thoughts kind of wander, and very quickly we start making negative predictions. So, something I recommend is, if you're working from home, maybe when you get up in the morning, have an exercise if you can. You can jump rope if you want. You can go outside, go for a run if you live in a place where it's sunny. No one is saying you can't go outside. They're saying avoid crowded places.
What's your question for our in-house psychiatrist, Dr. Colin Reiff? And his meter is ticking, but he's not charging you.
I guess my comment would be, I'm right at the bedside as a respiratory care practitioner, so I am at super high risk. But I still feel that all of us have to take kind of what's that book, 3 deep breaths? Because I think if the practitioners at the bedside, if we can modulate our response and not panic, it does a great deal to help reassure the people that we're caring for, as well as our family members.
Thank you for that comment, and that's modeling. If you're able to care for patients at the bedside, and if they have a family member in the hospital who observes that, they'll say, "Hey, I see this wonderful clinician, caring for my loved one or significant other, and they're not panicked. They're okay. So why should I be panicked? Things are under control."
In the process of dealing with another person's panic therapeutically, you probably calm yourself.
Yes.
I like to say, and I've been saying this since 9/11, that when these things happen, we end up with a societal PTSD of a sort. And I was reminded of that because of the word you use, catastrophizing, which it seems to me a lot of people are doing right now. I don't know what they're more afraid of, this virus or being quarantined.
And I think that's exactly what has people going, is that there isn't just one big event that's happened and now it's over. We don't have closure. We love closure. We love definitive answers, and we don't have them right now, and that's why there's so much anxiety. There's just so much anticipation of what's coming. But in all honesty, it's not that bad right now, so let's just stay prepared, remain vigilant, and do what we can do, to make sure that we limit the spread of coronavirus.